Hello friends, let's today talk about the life of hip replacement surgery. That means, for how long does a typical hip replacement surgery last? The answer is not very simple. But to make it simple, let's dive into the literature world. When we use large national registries like AJRR, NJR or AOAN-JRR, typically the pooled registry shows us that at the end of 15 years, almost 90% of the hips are working quite well. By the end of 20 years, 70% of the hips are working quite well. And by the end of 25 years, almost 58% of the hips are surviving quite well. Now there is a difference in the type of hip replacement surgery, age of the patient, and there are the technique related factors also. So overall, if we see, age definitely affects the survivorship of hip replacement. Now when we talk about age, basically the osteoporosis. Also the gender has an impact, especially women above the age of 65, there are higher chances of revision surgery required. Especially when we are doing cementless fixation at an older age. Also, when we go for younger patients, we normally prefer cementless fixation because they perform quite well and are widely used also. But in older patients, cemented fixation is of course better as it has longer survivorship. When we talk about a special type of fixation known as hybrid fixation, which is very common these days, the stem portion is cemented whereas the cup portion is uncemented. This is becoming very popular these days because it has low revision rate. Now there are some factors related to patients, some factors related to the surgery and also to the component. Like when we talk about the age and gender, patients with older age, patients with osteoporosis, cemented stems often they are better, especially in ladies above the age of 65. To some extent, patient factors also affect the outcome. Like if the patient is obese, the chances of revision are more. If patient is having diabetes, chances of revision are more. Smoking definitely lowers the life of implant. Also, fixation method, just as we spoke about just now, also affects whether you are using a cemented fixation or uncemented. Also, what kind of material we are using, that also makes an impact. Whether we are using ceramic or metal or we are using polymer grade, that also creates a difference. Component positioning and the experience of the surgeon, that also matters when it comes to longevity of the hip replacement. Also, if somebody is having recurrent infection or dislocation, that also reduces the lifespan. So, some practical tips to make your hip replacement last longer. What you should do is you should always maintain a good healthy weight after your hip replacement surgery. You should keep your diabetes under control and of course you should not smoke. You should do regular low impact activities to keep your muscles strong, like you should go for a walk or swimming or cycling. This is important, so that you strengthen the abductors or the core. And you should not do high impact activities like jumping or running or playing sports. Prevention fall is equally important as preventing any infection. Like you should definitely get a dental checkup. You should avoid skin infections, urinary infections. So you should be very careful not to allow any foci of infection within your body. Also, you should get regular x-rays and you should visit your doctor regularly. Old osteoporotic patients are advised to take proper treatment to treat osteoporosis so that your implant lasts longer. So overall, if you're planning for a hip replacement surgery, don't worry. Choose the right doctor, right technique and right implant for your age. Thank you.